2, 1.
Hello, Namaste, good evening. I'm Dr. Nalli Gopinath, orthopedic surgeon at Apollo Spectra Hospital. Today we'll be talking about managing knee joint, how to manage knee pain. So before going to the pain aspect, I thought I'll just tell a few words or some basics about how a knee functions or what is a knee. So a knee joint is just like any other joint, which is formed by ends of two bones. The speciality of the knee joint is that it has to bear most of the weight of the body of a person. So it is formed by the thigh bone and the leg bone. You see it in the larger model. This is the thigh bone and this is the leg bone. Inside of the leg there are two bones, one major bone, one big one, and a small one on the side. But the big one mainly shares the weight, body weight. So the ends of the thigh bone is like a ball. There are two ball-like structures in the lower part of the thigh bone. These bones sit on a platform-like structure on the leg bone. So in between these two bones, there are two washer-like structures which we call meniscus. So they work like shock absorbers and also help during jumping or other running activities. The ends of the bones are always covered by a smooth structure called cartilage. This cartilage is always soft, and this too has a function of shock absorber effect, but it is also protective of the bone. So when we keep walking or jumping or running or cycling, the cartilage works wonderfully well. It is healthy also. It receives plenty of nutrition or food supply from the blood through a tissue called synovial tissue. The synovial tissue is found all around the joint. This forms a capsule or a box-like structure. So the synovial fluid gives or provides all the nutrition for the cartilage. So maintaining the cartilage will be important in preventing knee pain. So that's the reason I'm talking about cartilage more. The ends of the bones have something called cartilage, which does not have direct blood supply, but receives all the nutrition or food supply from the synovial fluid. So all the joints are always covered by a capsule. Inside the capsule is the tissue called synovium, which provides all the food necessary. It also provides, synovium also helps in lubrication, just like oil for any joint. So this can help in lubrication. So nutrition and lubrication. So maintaining of the cartilage structure, the cartilage integrity or the health is always important for preventing knee pain. Okay, so now let us go to knee pain. Knee pain is most commonly seen after 40 or 50 years. Your young children or young people do not complain of knee pain. However, children of growing age can sometimes have knee pain. Such pain is called growth pain. When children start growing, when there is a rapid burst in growth, then children can experience pain around the knee joint or below the leg. This is called growth pains. So this takes over time. As the child grows, this becomes all right on its own. But if it is very severe, we give vitamins like vitamin E or any very rarely painkillers like ibuprofen, but are not necessary. Only vitamin E will be sufficient for growing children. And in adolescents or people or in the teens, when they are in the schools or in colleges, most commonly only injuries occur. Knee pain can be due to injuries. Very rarely there's a condition called chondromalacia, around 1 in 100 children or so. Very rarely some children can experience knee pain. Such children have to be evaluated with x-rays or with others, CT scan or MRI, to rule out other causes. There is a condition called chondromalacia patella, where the cartilage can be very softened. It can become very softened, and then that can cause pain. But it's a very rare condition, not very commonly seen. But if a child continues to have pain for a long time, then we'll have to rule out all this. Then between 20 to 40 years, most of the problems, they never occur. Only injuries can be, if you have any injuries due to falls or two-wheeler riding or injuries during sporting activities can cause any ligamental injuries like anterior cruciate ligament or the ACL tear, which is commonly seen, or a meniscal injury. These injuries are handled after investigation by most of the time surgeries. There is a complete tear. Very partial tears sometimes can be left to heal for some time, but most of the time even partial tears can cause trouble over time. So the ACL doesn't heal well. So ACL injuries are quite a common thing in the age group between 20 to 40 or 20 to 50 years. Such people will require arthroscopic surgery. Very rarely there's a condition where there can be a break of a piece of cartilage or a small piece of bone in between the ball-like structures which I told you, in between the thighs, thigh bone. So in the thigh bone, this small piece fragment which comes off is called osteochondritis. So such conditions are very rare, but however, if people between 20 and 50 years experience this, then we'll have to they'll have to be subject to a small surgery where cartilage from a different area, where a non-weight bearing from the sides is taken and then attached on that area. But not a very common thing. This can also happen. But the most common cause of knee pain mostly occurs after 45 or 50 years, and mainly in women, and then around after 50 or 60 years in men. Why does it occur? The knee pain most commonly occur in women. The reason commonly quoted is one common thing can be reduced calcium or reduced vitamin D3, reduced exposure to sunlight, reduced activity. As people they become more than 40 or 50 years, they will not concentrate on exercises. They may not be active enough. They would have probably all the things would have settled. And then increased body weight can also occur. Sometimes menopause, soon after 2 years after menopause, there can be an increase in the body weight. So this increase in body weight can also harm the knee. So we'll have to be cautious and then always monitor the body weight. So fitness is very important. And then regular activity, exercise activity is always important for the health of the cartilage. I told you, cartilage is the main reason for any knee pain. So maintaining the cartilage. So exercises help. So exercises like the thigh muscle exercises. The thigh muscles most commonly are called the front thigh muscles are called the quadriceps. So quadriceps, or the one in the front, is the quadriceps. So that has to be maintained. The strength has to be maintained well. So do plenty of exercises to increase the strength of the quadriceps muscle. So that can help in maintaining the blood supply to the cartilage. Cartilage remains healthy. So remember, thigh muscle, front thigh muscles are very important for maintaining the knee joint and maintaining the cartilage, and also preventing knee pain even after 40 years. So take care of the body weight also. Even minor increase of 2 or 3 kilograms of body weight can harm. So start reducing gradually. No rapid reduction procedures need to be done. Gradual reduction of the weight helps. Suppose sometimes after 50 there may be a sudden increase in pain in the knee joint without anything. One fine day suddenly they may have pain. Such people, when we investigate, if you do an MRI, they may have a minor or a small tear in the meniscus. The meniscus is a washer-like thing in between the bones. There can be a mild tear because of aging after 50 years. Such people require only just a bed rest or a knee brace. So they have to rest the knee joint for around 4 to 6 weeks, 1 to 1.5 months. Only a brace or a plaster or something which prevents the knee bending. If they prevent bending for around 4 or 6 weeks, the knee pain goes away, and then they can go for physiotherapy. Most of such people do not require any operation. A meniscal tear because of aging does not require any surgery. Meniscal tears in people between 20 and 50 years, young people during sports or any falls, such people may require a surgery when they have a huge tear called a bucket handle tear or something which can intervene the movement itself. A very minimal trivial injury or no injury at all, a sudden pain in the knee joint can always occur, and this is called a meniscal degenerative meniscal tear. This is one other common symptom or problem that we find in our outpatient department in our hospital. So after 50 years, many people, they come with knee pain, and such people, we evaluate them. We look for calcium reduction or D3, all that is corrected. And then we encourage them. If they are in severe pain, then we ask them to give some rest to the knee joint, and also physiotherapy and some mild painkillers. Most of the time after 50 years, we just give them paracetamol oriented tablets. For rest of the painkillers or anti-inflammatories can harm the kidneys. So we always go for paracetamol after 50 or 55 years. So very rarely, if the pain is very severe, then they may have to take few tablets of anti-inflammatories. Most of the time, they do well with paracetamol itself, which is a safe tablet. And then there are many brands of paracetamol. And physiotherapy also helps. Physiotherapy in the form of heat. Heat can be using machines, can be the short wave or interferential therapy. If the pain is very mild, it can be managed at home with ice cubes, ice packs, or even warm water packs. That too helps. If the pain is there for quite some time, then the physiotherapy in the form of interferential therapy or IFT or shortwave always helps. The duration may be around 10 or 15 sittings, which can reduce the pain very well. Paracetamol tablets also may be taken for 10 or 15 days alone to bring out the pain. But once the pain is gone, people should remember that they have to regain the strength of the thigh muscles. The quadriceps have to be strengthened very well. Exercise plays a very important part. However, after 50 or 60, if the people are very obese, if they are not able to reduce the body weight, and then because of aging or then reduction in D3, or sometimes by heredity, inheritance, they can have some genetic problems where the water content inside the cartilage can be reduced. The water which is reduced in the cartilage can cause damage to the cartilage. So such people, they go in for a condition called osteoarthritis. Osteoarthritis is just like graying of the hair or hair falling off or shrinking of the skin. So this osteoarthritis is unpreventable because of aging. However, it can be postponed by good activities like exercises. So remember, exercise always helps in postponing any problems that can happen even in families. So good diet, which contains plenty of calcium, have to be taken, and also concentrate on protein. Protein and calcium make up bone. So take good amounts of protein and calcium, and then good activities. In osteoarthritis, if the pain is very severe in a young patient, and if we take X-rays or CT scan or MRI scan, if the condition is in grade 1, suppose you can see one more image. I show you a doll. In this, you can see the whole blue thing is the cartilage. So healthy cartilage is blue or very soft thing. However, if there is minimal damage, we can grade it. That is grade 1, where you see this redness. The grade 1 can be reversed. The grade 1, you can see this one is this is the grade 1, very minimal change. Grade 2 is the change is more. So when there is minimal change, we can come back, we can reverse and go back. We can heal it by taking a few medicines and then few tablets, reduce the pain, go for exercises. A little rest during the painful period helps to get you back to normalcy, and the grade 1 can be healed. But once the damage passes from grade 1 to grade 2, or grade 3 is complete damage, so much of damage cannot be reversed, because the cartilage is replaced only by a different type of tissue called fibrous tissue, which is not like same as the cartilage. So before this goes into grade 2 or 3, we have to intervene and try to bring down all the conditions, the factors which can cause a knee pain. So very rarely, if people, in spite of taking all the efforts, if it goes in for grade 2 or 3, then they may have to undergo a surgery called knee replacement surgery, where we replace the cartilage. The upper part is shaven off, and then a metallic cap-like thing is given to the thigh bone, end of the thigh bone, and also a platform for the tibial bone. Only around 8 millimeters or 10 millimeters of bone is shaved off. Already there will be damage of 3 or 4 millimeters, but with the calculation, the upper part is just shaved off and off the cartilage, and then we have metal backing, a metal crown or a cap on the lower part of the femur, and a metal platform. In between, you have a washer-like thing which is made up of high-density plastic, poly, which we call poly. So this works like a washer, just like a meniscus. On these knees, recent knees made of titanium, they can work for around 15 to 20 years. So they can give you extra life for the joint, and you can be happily pain-free for quite some time. So being pain-free is the main idea. So surgery is the last thing that we do, and we need not be very afraid about surgery also. It gives there are wonderful results. The techniques have been advanced a lot. We have computer-assisted surgeries also. We can go in for perfection with computer-assisted surgeries. And then high-quality implants like titanium or oxenium are available, which can give you more life. The life expectancy of the implant also is there for a long time. But before we go to that, prevention is always better. Prevention better than cure. So keep exercising, remember exercising, good diet, maintenance of the body weight, and then improving calcium levels, vitamin D3 levels. All these help. I think this session would have been helpful to you. And if there is any questions, I think I can go for any questions. Is there any questions, Balaji? Works well. Any exercise, as I told you, it is a primary thing. So kept in mind, yoga works wonderfully well. It can cause stretching of all the joints. So most of the time after 30, we start aging by 30 years. When we begin our 31st birthday or 31st year, we start aging. That is when aging begins. So most of the time we have to learn yogasana in school and college and start doing yogasanas or all these stretching exercise. Being in India, we should definitely go in for yoga for whole of the body. So they can cause good stretching. All the muscles are stretched well, the ligaments are stretched well. So that is important. Same time, two things. The yogasana done properly can give you good enough strength for all the muscles. So muscle toning exercises with weights or with cycling or jogging can also help when we are young. So people more than 50, they need not go for exercises with weights or anything. Younger people should combine yoga exercises along with some resistance, like we call them resistance exercise, with some elastic band or some weights, or go in for swimming or cycling, which can improve the muscles in the bulk of the muscle. The bulk of the muscle is very important. If you have a good bulk, that protects any joint, particularly the knee joint. If you have good bulk in the front thigh muscles, so these muscles can help reducing any damage to the cartilage. So yoga definitely helps. We have a well-trained physiotherapists who know yogasanas also. Apollo Spectra Hospital has physiotherapists who can teach you yoga exercises also. We provide that care here too. Yes, it is available. You can utilize. Injuries, very commonly we can hit against a hard surface. Sometimes we are working in a closed space or in an office or anything, we may hit against a hard surface. So that can cause minimal crack-like things in the bone called patella. The thigh muscle, the front thigh muscle is called the quadriceps. So inside the thigh muscle, you can see there is a small piece of bone which is called the patella. So the patella too has a covering called cartilage, similar to the thigh bones. So this cartilage can have minor fracture like things or cracking. All that has to be healed. So whenever we have any knee pain after any injury, hitting against hard surface or anything, so that has to be healed by limited rest, 2 to 5 days of rest, and then ice packs. We call something called RACE, R for rest, and then I for ice packs, and C for compression. You can have a small elastic bandage, and then elevation of the foot during nights when you take rest. So RICE therapy, RICE. So that helps for acute pain. However, if the injury is severe, you fall down in a ground or you fall down in your residence, quite a significant injury, that can cause, as I told you, an ACL tear, the anterior cruciate ligamental injuries. Ligamental injuries, if there is really a partial or a complete tear of the ACL, then it doesn't heal well properly, then you may have to undergo a replacement of the ligament, which is called ACL reconstruction. One of the tendons or a small piece of structure in the ends of the muscle, the hamstring muscle in the back of the thigh or on the inner side of the thigh is removed. So that is taken as a replacement. Your own tendon is used for as a ligament, which will heal in around 3 months time. However, once the surgery is done, the very next day you can start walking around and then start exercising. By third month you should be all right. And many sports people, they can go back to sports by 6 months. This is an ACL injury. So this is about injuries. So minor injuries heal well with exercise, rest, RIC, and then exercises. Then if it is a major one like a meniscal tear or an ACL tear, then you may have to undergo arthroscopic surgery, which is available everywhere. Thank you. age also, have you given your mentioned or age? So young people needn't worry, just bring down the pain, go for exercises, learn exercises, simple things like cycling, and then half squats. I think you'll know about half squats, just squatting a half level, and then that can help in maintaining your knee. So that is good enough. When do you meet a doctor? If it doesn't come down with rice therapy, you apply ice, you apply warm water, and then you rest the joint. In spite of doing all this, if the pain doesn't come down, or if there is any swelling, sometimes there may be swellings which may not be directly involved to injury alone. Some people can have reactions. There's one other common thing called reactive arthritis. If you have a sore throat or any skin infection anywhere in the body, sometimes can discharge, or they can circulate some bacteria. These bacteria can spill over into the blood, and they can circulate, and that gets controlled over time. The body controls the bacteria with antibiotics of its own. The antibodies can fight and then reduce the bacterial infection. However, few particles that are remaining of these can cause irritation. They can cause an immune reaction, which can cause irritation of the synovium or the covering of the knee joint. The synovium produces synovial fluid, which gives oil-like material, also provides nutrition for the cartilage. So this synovial tissue can be irritated by the chemicals or the particles from the dead tissues of the bacteria. So this can cause some swelling in the knee joint. A sudden swelling has to be investigated. Usually we just investigate to rule out any bacterial infection inside the joint, or any infection in the blood itself, bloodstream, or any telltale evidences of a reactive arthritis, a reaction to an old infection. All these are found out. Very rarely, some people may be having rheumatoid arthritis, which is an autoimmune or a immune response system, the immune response inside the body. So that can go haywire, there can be some trouble, and that is called rheumatoid arthritis. This can cause irritation of the synovium. So there are plenty of reasons for irritation. Just like trauma, you hit against something, the synovium gets mechanically irritated. Chemically, it can be irritated by sometimes sudden increase in uric acid like chemicals, or any related chemicals, or sometimes rheumatoid arthritis or reactive arthritis. All this can be reduced once we find out the true cause of swelling in a knee joint. So if there is swelling, definitely you'll have to meet a doctor. Without swelling knee pain, you can treat it with cold therapy or heat therapy.
Next question. If I suffered a knee pain earlier in my life during adolescence, is it possible for it to recur again?
Definitely not. It is not a rule. So not a rule. Knee pain in childhood, we play a lot when we are children. So all children tend to fall and they can have knee pain. That is not the true cause of a knee pain in later in life. So all that heals very well. Children have a better healing capacity than older people. So it heals completely. That cannot be a cause of pain in the long run. However, if suppose there is any fractures near a knee joint, fractures around the joint, if they are not healed properly, if the shape is not perfect, then such conditions can go in for a knee pain later in life, after 15 or 20 years, or even 30 years later. So fractures near a knee joint, if they have not healed well, if it has healed well, it shouldn't be a problem. So only such people go on. So simple injuries, hitting against something, all this will never cause, may not be a cause of pain later in life. So concentrating on body weight, exercises, and diet, that should be thought of rather than any injury in childhood.
Next question. Are there any long-term implications of knee replacement surgery?
Long-term implications. A knee replacement surgery is a surgery, an operation done to relieve you of the pain. Why do you get pain? There is loss of cartilage. The cartilage is a protective covering of all the joints, of the ends of the bones. Just below the or under the cartilage, underneath the cartilage, you have plenty of nerve endings. The ends of the nerves are there. So these get exposed when there's damage to the cartilage, when we don't exercise, when we are overweight, when we don't take enough vitamins or anything, and then we don't do exercises, then the muscles can weaken, cartilage gets damaged, the nerve endings get exposed. The nerve endings are the reason for pain. So usually when people go to sleep, the bone ends, the muscles relax and bone ends come in contact with each other, causing severe, terrible pain during sleep. So that is one indication where we think about surgery. Patient will be suffering from severe pain during nights in spite of taking tablets like paracetamol. Then adequate amounts of paracetamol tablets too may not give enough relief. If there is no relief, even in the night, disturbance of sleep, disturbance during walking. So this surgery is done. This surgery is mainly done to relieve you of pain and gives you wonderful relief of pain, and then you can go back to your regular activities. You can even do exercises. There are people who play or do cycling too after this. So if you're an active person, you can go back to your athletic activities after a knee replacement. Long-term effects, the usually after 50-60 years, the usage of a joint is less in most of the people. They not very active. They don't use it like a youngster. They don't play football or anything. So the life expectancy or the life term of a knee replacement joint usually is 15 years is what they say. But with the recent implants like titanium or oxynium, this can be extended for another 5 years. So the knee replacements can work for 20 years. Absolutely, you cannot have any long-term side effects. The only thing that you have to keep in mind after undergoing a knee surgery, see to that your tooth doesn't have any tooth decays or anything. Whenever if you undergo any procedure for dental procedures, then you'll have to remember that there can be spillover of bacteria from the tooth. So you'll have to undergo a course of treatment for around 2 or 3 weeks of antibiotics, and you'll have to forewarn or tell the dentist that you have a knee replacement, a metal in the body. Otherwise, there should not be any trouble with the knee replacement. You'll have wonderful relief and better quality of life.
Next question. Sometimes my knee tends to rotate and I got lot of pain, but it always get better after some time. What should I do? Do I have to turn the meniscus?
No, any tear in the meniscus, I told you, minimal tears are expected after 50 years. But when you are young, between 20 to 50 years, if there is a tear in the meniscus, if it is significantly large, then we may call it a bucket handle or a loose tear, which can get in between the two bones when you bend or twist. So all the twisting activity is controlled by the meniscus. They protect your joint or the bones during twisting activity. So if a tear is there, that can cause you significant pain. If it is really troublesome, there is a surgery called just trimming of through arthroscopic, just pen-like structure. The arthroscopic tube is smaller than a pen, so that is inserted, and with the help of camera, you visualize inside. Only the torn portion alone is trimming. We trim and then balance the meniscus in such a way that doesn't get back into the bones. So a very minor surgery the surgery is far better than not having operated, because there won't be any damage. You can perfectly go in for all the exercises, then the loose portion alone is removed. So that is what you should think about if there's really a tear, and if you are young. People after 55 years, then they should not, they need not go for an arthroscopic surgery. They can just push on for some more time. But young active people, you should think about surgery, arthroscopic surgery, which is a very minor, safe procedure, can give you wonderful pain relief if there is continuously painful for a long time. So undergo a MRI investigation, find out if there is a tear, and then think about surgery if there is really a tear. If there is no tear, no worries, go for physiotherapy, reduce your pain, be careful.
So next question, doctor. My mother has
Arthritis.
osteoarthritis. Doctors have suggested surgery,
Yes.
but we are afraid to go for it. Any comments on that?
Yeah, people, you should be truly afraid if your parents are more than 75 or 80 years. We operate with care after 75, but between most of the people, they come between 55 to 75 years. That is the best time to undergo a surgery. People younger than 55, we try to postpone. If the patient has any severe problem at 50, we ask them to wait for some more time. We do all the other therapy till they cross 55. So after 55, these people undergo, they have wonderful relief of pain. So age is a big criteria. Even after 75, if your parents, if your mother or father is active enough, very active, even after 75, then they should definitely go for the surgery. They'll have wonderful pain relief, and then they can remain active. The surgical procedure, they'll be in the hospital for around 5 or 7 days maximum. Most of the time, they are discharged by 5 days. They are made to walk on the second day itself. And then with good physiotherapy, within a month, they can walk without any support. And then they can be back to themselves independent without any pain in the nights. So that should be aimed for. But other comorbidities, if there is severe, if the blood sugar is high or blood pressure is high, all these can also be controlled. We have good physicians who can control probably in 4 or 6, 1 to 1.5 months. All these can be brought under control, and then safe surgeries can be undergone. We do surgeries for people more than 60 or 70 also, and then they do well. Don't worry about the problems. There can be any problems. The surgery is very safe.
Next question, doctor, from a patient. My brother is just 34, but he has developed uh, a gout in his leg. What do you suggest a treatment, doctor?
GO
GOUT.
gout. Yeah, gout. Suppose get gout most commonly does not affect bigger joints. Gout is a condition where the uric acid goes up. As I told you, chemical changes. Sometimes for some people, hereditarily out of inheritance, it can run in families where the uric acid level in the blood can go up. Such people can have pain mainly in the big toes. They can have pain in the foot alone. So gout or hyperuricemia commonly never affects the bigger joints, only small joints in the toes of the feet are the common areas. Other area is the elbow joint. They can have swellings or damages. So quite easily, such people should think about reduction of meat, red meat, if they are a non-vegetarian. If they are non-vegetarian, reduce meat. If you are vegetarian, then there are few vegetables. There are lists available even in the internet, the type of vegetables to be avoided, like spinach and other things. So you go through it and then you avoid those vegetables to reduce your uric acid levels. Then if they are in the habit of taking alcohol, they have to reduce alcohol intake. Stress also increases uric acid. They should not be stressed out. So very rarely if they undergo any procedures like surgery, at that time the uric acid can go up. Rest of the time, reduce your stress, be calm, learn meditation, dieting, good diet, avoid few things like non the red meat or anything which can increase the uric acid, and then try to avoid alcohol. That should give good relief for your brother.
Next question, doctor, from a patient. What are the major risk factors of knee pain, and what would be your suggestion for a healthy prevention for knee pain?
Yeah, as I told you, I think you would have missed the earlier part. We were talking about the cartilage. So healthy knee joint means healthy cartilage and healthy muscles all around the knee joint. So keeping all the muscles of a joint which protect the joint, which provide food or nutrition, is very important. So keep exercising, maintain your body weight, don't be overweight, try to come back, try to reduce your body weight, for because the knees, the ankles, knees and ankles, they bear the weight of the body. They have to share and bear the weight. So the upper part, the upper half of the body has to be maintained. The weight of the body is very important. The knees carry the body weight. So we have to maintain body weight so that there is no increased pressure on the cartilage. If the body weight is perfect, you bring it to your normal levels at around what weight you were during 25 or 30. And then, or according to height, doctors would suggest you that this is your weight, this is how much you'll have to maintain. So in normal always not be obese. Try to get exercises regularly. Good diet means good protein, calcium, concentrate on vitamin D3 also.
Dog is like most on driving factor. I usually used to get like back pains, and right now my age is 42. How
Yes.
to reduce? How to avoid it, doctor?
Yeah, back pain. We are moving away from knee to spine. So spine too depends mainly on muscles. See, this is the bone structure. You have 5 bones in the low back. So this is from the front and then this is from the side. So the muscle, it contains lots of muscles. The spine or the back has plenty of muscles in the back. In the front you have the abdomen. Abdomen contains all the tubes, the intestines, the liver, kidney, spleen, everything is inside the abdomen. All these are packed. They are packed with plastic bag like things called peritoneum. All these, they are packed and then they are hung on the spine. The spine is like a pole or a pillar on which all these structures are stuck. So the spine has to hold all the tubes, the liver, everything has to be held by the spine. Lower spine holds all these guts. The upper spine has to take care of the lungs, the weight of the heart and everything. All structures are stuck to the spine. One more thing, the spine is not like a perfect pole. It is not like a pipe. It is made up of multiple segments. It is made up of 5 pieces. So why do we have 5 pieces? So these 5 pieces provide lots of flexibility. When you bend forwards, you turn, then you turn to your sides. All these activities are helped by the pieces of bone. They are not one full structure like a pipe. So just behind the spine, you have the nerves. The nerves run in a small pulse. down, at each level it gives off roots on each side. One is on the right side, one on the other left side. So these nerves can combine and form thick nerves which can run behind the back of the thigh, called the sciatic nerve. So commonly, if you sit for a long time, rather than driving, if you sit in a place for a long time, that can cause back pain. If you stand in a place for a long time, it can cause back pain. So try to avoid standing for long period, more than 40 or minutes or more than an hour. But try to give some rest. Don't stand for a long time. Don't sit in a place for a very long time, more than maximum 40 minutes. You need to take a break. You have to stand, go for a stretch out, and then sit. So driving continuously can also cause back pain if you if you go for long hours. So every 1 hour or so you take a small break during driving. Don't do driving continuously. And then if your profession is driving, then or you have to sit, then what you have to do is strengthen your muscles by doing exercises regularly, the spinal exercises, which can strengthen the front of the body, the abdominal muscles, the back of the body, or backside muscles. All these have to be strengthened by yogasanas or any strengthening exercises which you have to learn from a physiotherapist. Then keeping the body fit, don't try to put on a tummy. Too much fat in front of the body can cause strain, increase weight. So try to reduce weight around the tummy. Keep your muscles strong. Do exercises regularly. Try to take breaks when you drive. Don't drive continuously. That should relieve you of your back pain.
A final question, doctor. The same patient. While I am sleeping, I have a back pain, and I has been told by physiotherapist to keep a pillow at my back and sleep. Is it the right way to go proceed on it?
No, not at all. You shouldn't keep a pillow in the back or on the low back. The pillow should be behind the knee joint. So just under the knee joint. That is where you keep your pillow. So most of women, they'll have a huge curve in the low back. Women tend to have a huge curve. The spine is also bent more in women, more of a curvature like this rather than men. So such people can have difficulty when they lie down straight. When you lie down with your face up or on the back, then you have increased curvature, and this can cause some strain in the back. So to relax the strain on the back, you can always have a pillow below the knee joints. So that is recommended, rather than keeping any pillow on the back directly, low back. Keep it under your knee joints, which can help you. And such people also don't depend only on the pillow alone. If you're overweight, try to reduce weight. Do your exercises well. If you do your exercises, the pain should not be there. So, but in case if you have pain, you take time during therapy or during treatment, during the course of pain, you can definitely use a pillow. There is no harm in using a pillow below the knee joint. Don't keep it below the low back.
Doctor, if there is any back pain comes, if it is going to be a serious part in my life.
Nothing is serious in life. You can come out.
Age of the patient is 45.
Yeah, 45 is very young, not even old. So you start aging only after 50, after 60 or 70, you can tell you are old. Then elderly after 80 years. 45 is very quite young, and you can get back. So do your exercise as well. It is not at all harmful. All the types of back pain can be relieved, and you can come out of the pain. Keep in mind, number one, rather than diet, keep exercises as number one. Even if you are a little overweight, go for exercises, strengthen your muscles. Then you can think about reducing the body weight. So everybody should exercise, keep the muscles toned up, keep them strong, give some activity, keep moving around. Don't sit in a place for a long time. Don't stand in a place for a long time. Keep walking around. So movement is life. That is the policy in orthopedics. So move, move, move. Move your joint, move your muscles. Keep the muscles strong. That will take care of the health of the body and the back.
Okay, last question from a female patient. Age is 35. As I am into IT industry and my age is 35 years, can stress make us our body weaken?
Definitely, stress and body. Yeah, there's something called a terminology called psychosomatic. That is a common thing. Many of the time, the diagnosis psycho means mind, and somatic means body. So body and mind relationship is always there. If you are stressed out, you can have severe neck pain. If you're stressed out, you can have severe back pain. So in spinal issues, we always say the pain goes up during levels of stress. When you're really tensed, there is lots of activity, thinking activity, there are trouble, then you may find the pain to be aggravated. When you're relaxed, the pain can go away. So mind has a role in showing or aggravating the pain in spinal disorders most of the time. So definitely try to relax, cool down, learn exercises, learn yoga. Yoga is also the beauty of yoga is they also teach you meditation, comes along with breathing exercises. You do the exercises very pain. Back problem. So just like the formula I told you, keep active, go for minimal walks, and then increase the amount of walking. Walking itself is a very safe exercise, and then learn some spinal exercises. Think about your body weight, right? Reducing slowly. You can reduce half kilos in a month. So that speed is good enough. Every month you can reduce half kilos, 1 kilo in 2 months or so. Go gradually, reduce your weight, learn exercises, keep at least do walking, and then you should not have any mechanical problems like cracks or anything. Even there is a small fracture in the bone which can cause movement of the spine. Such people can also manage for 10 to 15 years without trouble if you concentrate on your body weight and then exercises. Don't lift heavy weights. Don't do frequent forward bending. So frequent forward bending can cause back pain. So at your home also, try to avoid frequent. Occasionally you can bend, but if you really want to keep your spine flexible, you'll have to learn some forward bending yoga asanas, forward bending exercises. If you do those stretches in the morning, then during the course of the day, if you bend suddenly also, it should not be a problem. So concentrate on exercises, stretches, body weight, good diet, and definitely you can come out of back pain.
And the next question is, Doctor, I am having a serious problem on my foot. So whenever I go for sleep, there is a burning sensation which has been happening. And my age is 37 years.
Okay.
How to recover from this? I'm taking some painkiller tablets, but it is not getting recovered.
Okay.
And I'm into the IT industry, Doctor.
Yeah, burning pain in the feet, 37 years only, and then only during nights, not very common. So the pain in feet usually is felt only in the early in the mornings when you get up from bed. The first step that you take that can cause severe burning pain. that can take around 5 to 10 minutes to reduce. That is the commonest finding. But a pain during the nights can occur from any problem in the spine. You have to think about the low back also. There may be some issues in the low back, a spinal disorder. You will also have to check your blood sugars. So check your blood sugars. So pain during rest, after all your activity, you come back from work, you sit for a long time, and then you come and take rest. And when you go to sleep, if there is any pain in the feet, that cannot be due to any inflammation or redness in the feet muscle, which are called plantar muscles. The plantar muscle pain most of the time is very painful early in the morning. So night pain is not very common, and they get relieved with painkillers most of the time. So if you investigate, you may need to check your blood sugars, check for reactive arthritis. Few blood tests can find out the real cause. You can go for an X-ray also, just to find out the cause, why, if there is any mechanical problem in the small bone where the muscles are attached in the heel. The heel bone is called the calcaneum. So have an X-ray. X-ray itself will reveal, and few blood tests to find out the cause for the burning pain. You should come out very easily be easily curable.
And the next question, doctor. Doctor, as I am a sports person and I used to play football every day, and my age is 32 years. Whenever I just climb steps, there is a slip which has been happening in my right knee, and I don't wanted to go for any procedures, doctors which has been advised. Is there is any other treatment options available?
Definitely, you're a sports person, and then you have pain during climbing stairs. That is what you say. You're young too. Then I think you would have undergone any MRI. If there is any ACL tear, there is a tear of the ligament, then definitely that can cause some instability. Or otherwise, you may have a meniscal tear. Meniscal tear during movement can get stuck and then can produce pain. If you want to avoid a surgery, avoidance of surgery in a ACL tear, it's quite possible. You'll have to strengthen your hamstring, the back thigh muscles, hamstring muscles, and the front thigh muscles, which are the quadriceps. Strengthening can give you better stability. You can push on for some time. However, if you walk on uneven surface, levels of, suppose you are walking on a ground or uneven ground, then you can have troubles of instability. Walking inside a hall or inside any hall, room or anything may not cause trouble, cemented surfaces. But uneven surface can give you trouble, so be careful. Climbing stairs, definitely you see some people have problems while climbing or getting down. So that is the main thing. The ligaments provide support. So you can manage only with your hamstrings. But however, if it is really troublesome, I think you should undergo an arthroscopic procedure if it is really troublesome. If the problem is small, then you can definitely avoid a surgery by strengthening your hamstrings and quadriceps. You can try that too. Try your exercises, wait for some time, then take your call.
Next question, doctor, one from Mr. Jitin. Is calcirol good for avoiding knee pain?
Calcitriol or calcium, if you are young, you don't need calcium. Who needs calcium? Calcium, you should take good amounts of calcium in your diet, at least 1 tumbler of milk, or you get calcium from greens, kirai or all greens and vegetables. You can get plenty of calcium. Non-vegetarians get their calcium from meat and then bones, what they eat. So easier for non-vegetarians to get their calcium. Vegetarians get it mainly from vegetables and greens, and then a cup of milk or so. So adequate quantity of milk during young age. But people, in women, you should have a different formula. So people, when there is stoppage of periods or after menopause, 2 years after menopause, women should start calcium, at least 500 milligrams daily. Actual required dose is 1 gram. You need 1 gram of calcium per day. However, if you are more than 50-55 years, there is stoppage of periods or menopause, you start your calcium 2 years after menopause. Concentrate on protein also. Protein and calcium are important for bones. So maintain these two in diet, good amount of protein, calcium, and then some exercises for any joint. Spine, go for walks, strengthen your knee joint, do spine exercises. So that should how you should go, concentrate according to age group.
So the next question is final question, doctor. Is there is any remedy for ganglion cyst?
Yeah, ganglion cyst, not a very dangerous thing, just a small swelling, not cancer or anything. Don't be afraid. Treatment is only if there is pain. It can be, if it is cosmetically, if you are If you don't want others to see, if you don't want others to comment about it, it is visible on the wrist joint, which is most common. If people keep telling about something, if it is very tiny, forget about it. If it is quite big, then simple treatments are available. You meet a doctor, they'll put a small injection after local anesthesia without pain. They'll insert a needle into the ganglion, remove the jelly-like material. You have just jelly-like material, remove it and replace it with hyaluronidase injection medicine or some steroid. That can give you wonderful relief. It can get flattened. You need not undergo surgery, definitely. Simple needling, you just put a needle, remove the jelly-like material, have some steroid or hyaluronidase. That will give you wonderful relief. And even this injection procedure, you should undergo only if there is pain. If it is really troubling you, go for it. Otherwise, just rest alone will make you all right. It's not very troublesome or very dangerous or anything. Ganglions occur near joints, which are just a bulge from the synovium, which produces oil-like material. Very easily treatable. Go for treatment if it is troubling you. No trouble, forget about it.
Thank you, doctor.
Thank you.
Thanks
Thank
for
you
all
very
the-
much for the time, and then I hope it would have been useful for you. As I told you, you can meet us at Apollo Spectra Hospital if there are any problems with you in orthopedics. Take care. Thank you. Good evening.